Hi there and welcome. My name is Dr. Marlena Jabara, and I'm the proud founder of RadPodSquad. The RadPodSquad Fellowship offers an immersive learning experience tailored specifically to podiatric imaging. RadPodSquad combines comprehensive curricula, cutting-edge techniques, and on-demand access to training that will provide you with the new knowledge and skills that you need to boost your confidence in imaging and truly make a difference in treating your patients. Check us out today, radpodsquad.com. Now let's highlight pseudoneuromas. Pseudoneuromas is the situation where you have eccentric pericapsular fibrosis within that intermetatarsal space. So let's take a look. We have the enlargement of the region of the intermetatarsal space, and within that we have the enlargement of the interdigital nerve, and we can see the elevated signal intensity denoting the pericapsular soft tissue swelling. And on T1 weighted image, we can see that that has replaced the fat and created a fibrofatty inflammatory change that's lying closer to the second MTP joint capsule in a situation that's best termed out as a pseudoneuroma. By terming it out as a pseudoneuroma, we're more likely to alert the clinician that what we need to treat here is a plantar plate tear. Case we're assessing this large M3, M4 interdigital lesion, all the features of this enlarged interdigital nerve. And we're now assessing again the difference between a neuroma and the non-neuromatous lesions. Those non-neuromatous lesions would be seen in association with the plantar plate tear. And like some Morton's neuromas, it may have intermediate signal intensity on T1 and T2 weighted images. So what we can see here is enlargement of this interdigital nerve. We can also see there is a large defect in the plantar plate attachment through the interosseous musculature. We have tears of the accessory and the proper collateral ligament on this side. When we look at these sagittal images, we can see an actual defect in the plantar plate gapping itself. We see very thin, stretched out, torn appearance of the lateral side of the plantar plate here, as evidenced here. And what we have is this enlargement of the interdigital nerve and edema, stress-related change and erosion, actually, at the third metatarsal head and at the fifth as well. This is a patient that likely has underlying inflammatory arthritis, as seen here with these erosions almost at all the MTP. In this distribution, we'd favor rheumatoid arthritis as the etiology. So we have this large interdigital enlargement. It is composed of this fibrosis, this perineural fibrosis, that is seen in both Morton's neuromas and pseudoneuromas. So let's take a look at an unusual case where we have a very large interdigital nerve. We can see there's inflammation surrounding this region, as seen here in the intermetatarsal bursa. When we look at its relationship to the plantar plate, we can see that there is an associated plantar plate tear at the lateral aspect of the third. Also note that there are erosions and bone marrow edema not only at M3 but also M5, M1. In a case like this, we would suggest that there's underlying rheumatoid arthritis. Getting back to this lesion, as has been described, this pericapsular fibrosis accompanies most cases of plantar plate tears. And in fact, it's a very important early sign to pick up, again, because these pericapsular pseudoneuromas can identify a plate tear at an earlier sign in the disease than was previously thought. So in the past, if we were to think that this enlargement of the interdigital nerve was a neuroma and we treated the neuroma, we would miss the fact that there is a large tear of the fibular side of this plantar plate. And you can see on the sagittal images just how thinned out and torn this plate is and the stress-related edema that's occurring in the metatarsal head. Also notice the exaggerated joint effusion and the cartilage loss in this location. So pseudoneuromas and neuromas do have a crossover, especially when they're this large. This one causing certainly probably a degree of pain and mass effect, exacerbating the erosion and altered biomechanics. I'm certain that the patient probably experiences a click. Now let's take a look at this fourth interspace where we can see this enlargement of the interdigital nerve here, and we can see the two limbs. And again, there is some kind of inflammatory change or this intermediate T1 and T2 signal lying closer to the fifth MTP joint, which also has a very large tear of its plantar plate itself. We can't even identify a normal U-shaped structure to even say where that plate is. And when we look at the sagittal images, you can appreciate the high-grade tear that's occurring on the fibular side of this articulation. So again, pseudoneuromas versus neuromas, the important distinction is twofold: eccentric pericapsular fibrosis, now recognized as an important and useful correlate. It can be more readily apparent than a small defect in the plantar plate itself, so we're going to pay close attention to any pericapsular capsulitis or synovitis so that we can avoid misdiagnosing those as neuromas. Thank you. Are you ready to take your podiatric imaging skills to new heights? Check us out at radpodsquad.com. Explore our online learning community. And don't forget to like and subscribe to our YouTube channel for more enriching content.